The IMpassion130 trial was a randomized phase 3 study that was really looking to see if adding a checkpoint inhibitor to chemotherapy would improve outcomes for patients with metastatic triple negative breast cancer. And so the trial randomized patients in the first line setting with metastatic triple negative disease to receive either nab-paclitaxel alone or to receive nab-paclitaxel and atezolizumab. It's important to realize that all the patients who went on to this study had to be a year out from their adjuvant taxane, and they were also stratified by their PD-L1 status. And the trial had a complicated design in terms of assessing endpoints. So it looked at co-primary endpoints for both progression-free survival and for overall survival, and actually looked at these both within the intent to treat population as well as within those patients who had PD-L1 positive disease. So it had a hierarchical design such that you had to meet your endpoint in the intention to treat population in order to statistically analyze the outcome in the PD-L1 positive patients. And so what the trial found was that adding atezolizumab to nab-paclitaxel did improve progression-free survival, both in the intent to treat population as well as within those patients who had PD-L1 positive tumors. And the difference was about 2.5 months in terms of PFS in those patients who had PD-L1 positive triple negative disease. And then when we looked at overall survival, we actually saw that the study did not meet the overall survival endpoint in the intent to treat population. And so again, remembering the hierarchical design, statistically you then couldn't actually analyze the outcome in the PD-L1 positive group. However, this was still looked at, and what was found was that there was a 7-month difference in overall survival favoring the addition of atezolizumab. And so while technically one couldn't statistically analyze these, I think it's, to us, just such a clinically relevant difference in overall survival that I think it shows that checkpoint inhibition added to taxane chemotherapy really is not only providing an improvement in progression-free survival in those PD-L1 positive patients, but also is extending survival for our PD-L1 positive patients. And so, this is really quite critical because prior to the use of checkpoint inhibition in triple negative disease, overall survival was only around 12 to 13 months for our patients. And so having an option that extends survival for this population of patients is really quite critical.